Hi, my name is Tony Edwards. I'm a student at Maryville University, and I'm going to be completing my head-to-toe assessment for Nursing 612. My volunteer here today is Dawn. Before Dawn entered the room, I obtained a height and a weight, vital signs. I also had her empty her bladder. We completed the distance vision test and the near vision test by using the Snellen and Rosenbaum charts. I had her change into a tank top and a pair of shorts for the assessment, and here we are. When she entered the room, I looked at her general appearance, and I also looked at her gait, which was all within normal limits. So, hi Dawn.
Hi.
I'm going to be performing a head-to-toe assessment on you. So I'm going to start off with her scalp. Her head is normal cephalic. I will palpate her scalp. You feel any tenderness?
No.
All right, good. I'll look at her hair distribution and texture, and I don't see any. It's well distributed, and texture looks good, and no signs of alopecia. I'm going to move on to her face, and I'll inspect her face. Her face and her features are all symmetrical. I'll do some cranial nerve testing. So Dawn, what I'd like you to do is raise your eyebrows for me. Good. And can you close your eyes real tight? Good. How about smile? Can you frown? How about clench your teeth and stick out your tongue and blow your cheeks out? Very good. All right. Next, we're going to move on to test sensation. So we're going to do light sensation. So I want you to close your eyes, and when you feel me touch your face, go ahead and let me know.
Yep. Yes. 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 Yes.
Very good. Now we're going to look for dull versus sharp sensation. So I will test that. I want you to let me know if it is dull or sharp.
Sharp. Dull. Dull. Sharp. Sharp. Dull.
Okay, very good. All right, so I'm going to move down to her eyes. So her eyebrows are extend symmetrically to the outer canthus of her face. I don't see any redness, inflammation, swelling, any extra tearing or drainage from her eyes. I'm going to have you close your eyes, and I'm going to palpate your eye. Does that hurt at all?
No.
And I'll palpate her lacrimal ducts. No tenderness there?
No.
Good. Her eyelashes extend upward and outward, so that's normal. And I will check out her sclera. It's nice and white. There's no signs of jaundice or redness or issues there. And her conjunctive looks pink on both sides, and no issues there, so that looks good. Next, I'm going to palpate her sinuses. So her frontal, does that hurt at all?
No.
And her maxillary sinuses? No problems there? Okay. And then I'm going to palpate her facial bones. You know if there's any tenderness there?
No.
Okay, good. All right. I'm also going to check for TMJ here. So what I'm going to have you do is open your jaw. Okay. Close it. And then open it one more time. Any popping or clicking or anything like that? Good. All right, so that looks good. Next, we're going to move on to her ears. Both her ears are midline, and they are symmetrical. And they line up with her eyes. The outer side aspect of her ears, I don't see any lesions, any issues there. I'm going to do the tug test. Does that hurt?
No.
What does that hurt?
No.
Good. Any problems with any of your hearing? No. Okay. So I'm going to perform the whisper test. I want you to go ahead and cover up your right ear. And I'm going to whisper something, and I want you to let me know what I'm whispering.
Orange. Orange.
Okay. Now cover up your left.
Apple.
Oh, very good. All right. Now we're going to perform the Weber test. And I want you to let me know if you have hear this in both ears or one ear or the other.
Oh.
Good. All right. And now we're going to check for air conduction versus bone conduction. So I'm going to put this against your mandibular area, and I want you to raise your hand when you do not hear it, okay? And then I'll move it next to your ear and you let me know when you can't hear it. And air conduction should be 2 times greater than bone conduction. And I would perform that for the left ear as well. So that was all normal. Okay, next I'm going to move on to her nose. And her nose is symmetrical. I'm going to shine a light and look into your nose. Do you have any problems with any of your smell?
No.
Okay, I want you to occlude your left nostril. And just breathe. No problems there? Okay, what about your right? Okay, so there's no nasal flaring, no obstruction, anything like that. All right, I'm gonna go ahead and shine a line up your nose here. And her turbines are oval and they're symmetrical. Her mucosa is nice and pink. Her septum looks symmetrical, straight, not deviated. So no issues there. And while I have my pen light out, I do need to check your eyes. So I'm going to go ahead and check for direct and consensual on her eyes. So what I want you to do is I want you to stare at something on this back wall here. So, and I'll be shining a light in your eyes. Good, so we have direct and consensual there. And direct and consensual there. Good. So her pupils are equal reactive to light and they're round. So next we're going to check the cardinal gaze. So while I have my pen light out, we'll be doing that. So what I want you to do is I want you to not move your head and I want you to follow my pen light. Okay, so there's no jerking, no twitching, no nystagmus. And her extraocular movements were all within normal limits, so that looked good. All right, so next I'm going to move on to her mouth, okay? And so I will just inspect her lips, and I'm looking for any cracking, any fissures, any bleeding in the gums. I'm also going to look at the color. So her lips are nice and pink, no issues there. I'm also going to look on the inside. I'm going to look at her tongue, her teeth, her oral pharynx, the soft and hard palate, her tonsils, and her uvula. So I'm going to have you open your mouth here. And I'm going to look at her mucosa here, and it's nice and pink and smooth. Her teeth are nice and white, and she's got normal dentation. I want you to stick out your tongue, okay? Her tongue is nice and smooth and pink and well palpated. I want you to put your tongue to the left and the right. And what about the roof of your mouth? Can you touch the roof? Good. So she's got normal movement there. Next, I want you to stick out your tongue and say, ah. Okay, so her uvula rises and falls equally. And one more time. Okay. And she's got tonsils on either side, and they do not appear to be swollen. All right, so that looks good. Next, we're going to move down to her neck. Okay, so I would inspect her neck, and I don't see any lesions, goiters, masses, anything like that. We're going to move on to palpation here. So I'm going to start off by palpating her lymph nodes here. So I'll do preauricular here, and let me know if there's any pain.
No.
And postauricular.
No.
And occipital.
No.
Okay. Then we're going to move on to the superficial anterior cervical nodes, and then the posterior cervical nodes, and then the deep. Okay. We're going to look at tonsil, submandibular, and submental. Any issues there? No. And then the supraclavicular nodes. Any issues there?
No.
Okay, good. All right, so next I'm gonna palpate her trachea here and make sure it's midline. It is. Okay. And then next I'm gonna have you swallow for me. Good. And her thyroid moves freely up and down, so that's normal finding. I don't see any jugular venous distension. I'm going to actually check carotid pulses here. It's 2+. Another 2+. Good. And then I'm going to listen for any bruits here. The bell of my stethoscope here. No issues there, so that's good. Now I'm going to check range of motion. So I'd like you to shrug your shoulders. Good. Can you put your chin to your chest? Good. And how about side to side? Any pain with any of that? Okay. I'm going to add a little resistance. So go ahead and push against my hand. Good. Good. All right. So I'm going to move on to her arms here, and I'm going to inspect her skin, and I don't see any lesions, any rashes, any swelling, any issues there. And both of her arms look symmetrical. I'm going to check her hand for any clubbing, so there's no clubbing. And cap refill is less than 3 seconds, so that's good. We're going to move on and check pulses here. So I will check a radial pulse, an ulnar pulse. Move your bed up. And then a brachial pulse. Those are all 2+. All right, next I'm going to check her strength of her arms. So I want you to squeeze both my hands here. Good, good. Can you go ahead and put your thumbs down? Good. How about put your arms over your head? Any pain with that?
No.
Okay, good. All right, so now I'm going to move on to her posterior chest. So what I'm going to have you do, Dawn, is I'm going to have you swing your legs to the other side of the bed here. Great. All right, so I'm going to start off by inspecting her posterior chest here. And I don't see any masses, lesions, no problems there. There's no lumps. I'm going to look at her workload of breathing, and her breathing looks symmetrical. She's not using any accessory muscles. She doesn't appear to be in any distress there, okay? So next I'm going to palpate. So I want you to let me know if anything hurts here, okay?
No.
Okay. The curvature of her spine looks all normal. It looks convex and then concave here, so that's all normal. Next, as you feel me put my hand on your back, I want you to say 99.
99. 99. 99. 99. 99. 99.
Good. And that is equal throughout too, so that's good. All right, so next I'm gonna go ahead and percuss. So, so there's resonance there. And I'm also gonna make sure that there's symmetrical excursion here. So I'm gonna find the 10th intercostal space, and I will put my hands and look for equal movement when she takes a nice deep breath in and out. Good. And both of my hands aligned and they were symmetrical, so that's all normal. Next, I'm going to look for a diaphragmatic excursion. So I'm going to go ahead and percuss, and I'm going to look for when it changes from resonance to dullness and make a mark here. So Dawn, what I need you to do is I want you to take a deep breath in and hold it. Okay, and let it out. Okay, so I put a mark right here. All right, so next I want you to take some normal breaths. And what I want you to do is take a deep breath in and blow it out and hold it. Okay, so I'd make 2 marks here, and I would measure the difference. And normal diaphragmatic excursion is between 3 and 5 centimeters, and so that's a normal finding. And I would also do this on the right side as well. So very good. Next thing I'm going to do is go ahead and listen. So I'm going to auscultate. I want you to take some deep breaths for me. Good. Very good. All right. And one last time, when I have my stethoscope to your back, I want you to say 99.
99. 99. 99. 99. 99. 99.
Okay, that was muffled, and that's normal. Her lungs were clear, and I heard vestibular breath sounds when I was auscultating, so that's all normal findings. Okay, Dawn, I'm going to have you swing your legs back my way here again, okay? And next, I'm going to inspect her chest, her anterior chest. So I am looking for the contour of her chest. I'm looking for any lumps, any masses. I'm also assessing her workload of breathing here, making sure that she's not using any accessory muscles and not having any problems there. So it all looks normal. All right, next I'm going to palpate the front of her and let me know if there's anything abnormal, anything's tender. No? All right, good. I'm going to go ahead and also ask you every time I put my hand on your chest to say 99.
99. 99. 99. 99. 99. 99.
Okay, so tactile fremitus is equal throughout and symmetrical, so that's good. Next, I'm going to put my stethoscope and I'm going to listen to your lungs here. I want you to say 99 when I have my stethoscope on you.
99. 99. 99. 99. 99. 99.
Okay, so that's muffled and that's normal finding. I'd like you to take a deep breath in for me. And out. Another. And out. Okay. Lungs are clear, they're equal throughout, and I heard vestibular breath sounds, so that's all normal. So we're going to move on to the cardiac system. So with the cardiac system, I'm going to go ahead and listen to heart tones here. So I'm going to start off by listening to the aortic valve and the pulmonic valve. The mitral valve, and the tricuspid. Okay, I didn't hear any extra heart tones. I heard S1, S2. There was no gallops, no murmurs. I'm also going to look for any heats or thrills here and feel for them. I don't feel anything, so it's good. All right. Dawn, what I'm going to have you do is I'm going to have you lay down, and I will listen to heart tones again. And then I'll have her go roll to her left side, left lateral position, and then I will listen to heart tones in that respect as well. So. Again, no extra heart tones. So Dawn, can you move on your left side? Okay. And again, I'm going to feel for maximal impulse point, and then I'm going to also listen to heart tones while she's on her left side. Okay, so that looks good. All right, you can roll back. All right, I'm going to move on to an abdominal assessment here. All right, so I'll have you raise your, there we go. All right, so I'm going to start off with inspection here. So I will look for any pulsation, any bulges, and I'll look at the contour, and that all looks good. Dawn, I'm going to have you raise your head up a little bit. There we go, and I'm looking for any kind of hernia or anything like that. You can put your head back down, that looks good. All right, so the next thing I'm going to do is I'm going to auscultate. So I would auscultate in all 4 quadrants for up to 2 minutes. Okay, and with the bellow of my stethoscope, I can check for any bruits. So I'm going to look for an aortic bruit. And then inguinal, renal arteries branch off of that, and so I will listen for bruits on either side. Just below the umbilicus. Okay, and I hear no bruits there. Okay, next I'm going to move on to light palpitation here. So I want you to let me know if anything hurts, okay? Oh. Okay, good, good. All right, and then we're going to move on to deep palpation, okay? So again, I want you to let me know if anything hurts. I'm looking for any lumps, any masses, any tenderness. Okay, good. All right, so next I need to do some percussion. So I'm going to percuss. Okay, and I heard timpani, which is a normal finding. I'm going to go ahead and percuss for the liver. So I'm going to percuss until I go to dullness, and then I'll mark that. Okay, so I put a mark there, and then we're going to percuss again. Okay, and I mark that, and that would be where my liver would be. You can do the same on the left side for the splenic border, although it's hard to get. So next I'm going to palpate, attempt to palpate the liver here. So what I'm going to have you do is I'm going to have you take a deep breath in here, okay? Okay, and out. One more time. And out. Okay, and the liver edge should be nice and smooth. We can do that on the left side for the spleen, but in most people you cannot palpate it, so that's it there. All right, so I think we're done here with your abdomen. I'm going to move on to her legs. So I would inspect her skin. I would look at muscle tone. I would look at the color of her skin, look for any masses, lesions, anything, any deformities, anything out of the ordinary. Next, I'm going to check your pulses. So her dorsalis pedis is a 2+. Posterior tibial, 2+. Her popliteal is a 2+. Okay. I would also assess her range of motion and her strength. So I'm going to have you push down. Good. And put your toes towards your head. Good. All right, I want you to raise your leg up. Don't let me put it down. So just raise it up. There we go. Good. And next to this one. Good. Now I want you to take your heel and rub it against your shin up to your knee. Good. Same with the other one. Okay, that looks good. John, I'm going to help you sit up. And we're going to hang your legs over the side of the bed here. And we're going to check reflexes next. So I will move. There we go. Check reflexes here. There we go. And her Achilles. And her brachial. There we go. And her radial. There we go. All right, Dawn, I'm going to help you get off the bed here and stand up. What I want you to do is I want you to stand on one leg. Good. And how about your other leg? So she has good balance. Next, I want you to touch your toes. Very good. And I would check her curvature of her spine there. And lastly, I want you to close your eyes, put your arms out at your sides. Okay. Some negative Rombergs. All right. I think this concludes our head to toe assessment. Thank you very much.